In the next 30 minutes, we'll learn about new ways of reaching out to family members with health issues, new ideas about the best way to care for them and to care for ourselves. Join us as together we explore options for reimagining late life.
Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Life Course project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.
It's a period of time many are now calling late life. It's that stage between our healthy years and our final months. Late life may be an extended period of time when our capacities are diminished, but when we still want to live engaging, fulfilling lives. Over the past few months, Allina Health's Life Course project has granted TPT unique access to research that they are conducting on alternative and more promising approaches to late life. Tonight, for the next 30 minutes, we'll look deeper into this new life stage, why our attitudes about it are changing, and why we all should care. Any discussion of late life starts, of course, with people. We start off with some brief clips introducing you to the DeMars and Scatarelli families.
Please rate your pain now. No pain, mild pain, moderate pain, or severe?
I'd say mild.
She went for a regular routine physical, and part of that was a chest x-ray. And they found a shadow, and they investigated that a little further.
And they found cancer in every bone I've got. It really came right out of the clear blue sky. It just was really something.
When we saw the oncologist, gave us a little bit of hope.
They said that it would be the kind that would be very slow going. That is apparently the way it's ended up.
She was put on a medication, too, to slow the cancer down.
And that was about, I think, a year and a half ago.
So then we had to regroup and think about, now how are we going to move on and what does this mean? It was a very emotional time for the whole family, actually. It made you think about your life together. You know, and how are you going to spend the remaining time?
Median survival for stage 4 non-small cell carcinoma of the lung is limited. It's in general less than a year.
I heard it that the timetable was 8 to 12 months normally. Bob has actually heard it to be 3 or 3.5 years. And more power to him if he wants it to be 3 or 3.5. And we're intending that it's going to be longer than that. But I just let him think that that's what the timetable is.
The statistic does not tell me how an individual will do with any disease process. I can't say what the future holds.
I'd like to live another 20 years with Marilyn. Except, you know, I know that that won't happen. But I want to keep the last years as good as the first 27 have been.
Well, as we've seen, many Minnesota families are struggling with late life concerns. Cancer, brain diseases, heart failure, and other chronic conditions all create big issues. Let's talk now about some of the challenges they bring to ourselves and our loved ones. With us to do that are 3 people, each of whom has been a late life caretaker for a close family member who has died. Tom Swain, long engaged in public policy debates. Tom is a former U of M executive. Dr. Penny Wheeler is the president and CEO of Allina Health. Here too is Morris Goodwin, the chief financial officer of American Public Media Group. Dr. Wheeler, I'm betting folks will think, because you're a physician, you obviously know about caretaking, you know how to navigate the system. How are your experiences as a caregiver?
You know, I think, you know, a lot of this comes of experiences that are born and how can we make things better. As a caregiver, I got one really early in my residency training, and it was a poignant one. I had a patient who had ovarian cancer. I was training at the University of Minnesota. The patient's name was Beulah. Beulah had a complication after her ovarian cancer surgery, and she got very sick. I got to know the family really well because I was overnight every 3rd night, and I got to know them well. She was of Native American descent. She told me about traditional culture. She was a wonderful woman. Her infection got so bad that the doctor, who was the attending doctor, determined that she had to go back to the operating room to clear up the infection. On the operating room table, Beulah, in the weakest voice but the loudest voice she could muster at the time, held my hand and said, "Don't let them do this." Don't let them do this. And we did the operation, and actually that was the last thing Beulah said. I think she would have rather said her last words to her daughter, who was constantly by her side. But that taught me that we can do better about understanding what people want.
So were
as
your
they're facing
experiences
late
with
life.
your family member, were they any different?
Yeah.
Were they the same?
Pretty, kind of similar. My father died of congestive heart failure. He knew he was getting sicker and sicker. We took care of him. Our system, Allina Health, took care of him. And we didn't do it always as best we could. He called 3 times one time to get medication done. He took 3 trips to the pharmacy, and it wasn't ready for him because nobody had made that connection. And he looked at me and he said, that was 3 days of my life, and I don't have too many days left. So we felt like we can do better as a system in supporting people in late life, and I certainly.
To the pharmacy.
Why
Why did it take 3 trips to the pharmacy to get a prescription?
Because there wasn't a connection made between his care team and the prescription being called in and ready for him.
Say, Tom, what do you think our society, you've thought long and hard about these issues, what do you think our society doesn't understand about caregiving?
Well, unless you've been there, you don't really have the inside knowledge. My wife was diagnosed about 5.5 years ago with vascular dementia. I remember the neurologist telling me, don't change your lifestyle too much or it'll take you down too. And I made adjustments and what have you, and I observed people that were caregivers so intensively that it really took them down. It was a way to really try to balance this. And
So Tom, if I could interrupt, does that mean that you deliberately made yourself stand back from engaging as deeply
I
as you wanted
adjusted
to?
my standard of living in a way, and we had a caretaker come in and for the first couple of years, and I was home more often at night, and then she fell and was, she became a patient in the memory care unit that took extraordinary care of her. And my kids said I took better care of her than they thought I would, and I take it that their initial expectations must have been very low because I dealt with it. But she ultimately fell, broke her hip, had a stroke and surgery, and then it was 16 months on hospice. And I went in every day and fed her and took care of her because she was totally incapacitated. It was a new experience, but you live up to whatever is expected of you, and I kind of miss doing that now.
Did you find the dynamics, and full disclosure here, I was a caregiver to my dad who had primary progressive aphasia and some part of dementia and other issues. But the dynamics changed, and I bet, Morris, it did for you too. Didn't your mom have, you cared for your mom?
Yes,
so you become the parent to your parent.
It's a very transcendental, odd change in relationship. And I was very uncomfortable with it. My parents both were just rocks in the family, and everyone sort of turned to them for all of their emotional guidance. And to have to find myself in a position where my mother was turning to me for cues on how she should be dealing with this emotionally was very, very difficult for me to understand. And there isn't a lot that the system can provide you with in terms of your own emotional coping skills. Because a lot of times you're so deep into the caregiving that you don't even know that you have them.
That's so true. Part of what we're talking about here today too, and I don't know about your respective loved ones, I never asked my father, how do you want to spend the rest of your life? Because my dad had some communication issues at the end and he couldn't speak. But did you ask your parents that?
Yeah, I wish I would have asked more, and more of people like Beulah and more of my parents. And I think that's what conversations like this have to start to bring out. How do we start to talk to each other about what matters most? All of us are going to face this. Very few deaths happen suddenly. All of us will face this at some time. How do we start to open up these conversations about what matters most? How do you really want to live your days? How do you want to live well the last 20 years of life, the last 2 minutes of your life? I think we have to open up the conversation and honor those choices as best we can, and we can do better.
Tom, how did you do that with your wife?
Well, her dementia progressed to a point where communication skills were badly damaged. Although I have to tell you this, She couldn't communicate except every once in a while she'd pop up with something. And about 3 months ago, just shortly before she died, she looked at me and she said, "I wish we were living together again so I could keep telling you what not to do." Seriously. There was an awareness back there. She couldn't communicate it. It was a great frustration, but you know, you adjust, you measure up to it, you do what needs to be done.
That's right.
If we don't do that, who's going to do it?
Yeah.
Although trying to understand exactly what they need and want, especially with a dementia patient, is a challenge.
Is very difficult. As we talk about living life as full as you can, no matter the circumstances, I'm curious, what do you think you do with a person who might be angry, bitter, depressed, hard to get along with, or maybe in denial of their situation?
Yeah. Well, I was extremely blessed and fortunate that both of my parents knew exactly how they wanted to manage their remaining time on this plane. And it wasn't them, it was all the rest of the family members who did not want to deal with that. And since I was the medical representative for both of them, all of the pressure to make sure that their wishes were served, that there was no resuscitation, none of that. They just wanted to leave this world naturally. That pressure, you know, fell on me, and everyone thought that I was trying to get my parents to die sooner.
Did they have a
And it
good
was a
health care
terrible thing.
directive?
Healthcare
Did your parents
directives
have
are
a good
key.
health care directive?
Yes, they did.
But you still had to
Very well
navigate
defined. They
through the
still had to
family
right,
dynamics,
the
right?
family members didn't want to hear about that.
But isn't the case of health care directives not being sufficiently explicit and directive now that we need to do a better job on that front?
I think that's a technical aspect. I think that's you know, some wishes on paper, but I think, Morris, what you were talking with about are the more adaptive ones. You know, how do we get through these things and think about the hearts and minds of the loved ones involved? And, you know, if we can get up front, Kathy, maybe, and I'd be interested in your experiences too, on what the wishes really are, then can we stop some of the bitterness and the anger and frustration?
Do you think, hang on here, Tom, do you think that doctors are willing to listen, really listen?
Yeah, I think that many, many doctors think we do way too much because we know too little about what we want, what people want. I mean, 80% of people die in hospitals, while 80% want to die at home. We do too much because we know too little about what they really want.
What they really want.
What was your experience?
Well, we have just a brief moment in time here, so, but why don't you go ahead and we'll wrap this up, Morris, and we're going to go on to something else real quick.
Well, I would just like to emphasize and to call on the healthcare professionals to remember that we don't know as much about how we should be managing these situations as we might appear to be. And so if you take a risk, the risk is to give us more advice than we think we might be soliciting.
And real final word from Tom Sweat, I didn't want to leave you out.
Oh, no. Last thing I feel is left out. No. I just had the one personal experience on the caregiving front, and I learned a lot. Actually, I miss part of it now. There was something different. I was caring for her in a way physically that, well, I'm glad I rose up to it.
There was great sorrow, but great joy, I think, in caregiving. Yeah.
Absolutely.
I wish we could continue this part of the discussion, but I have to move along. So I appreciate it. Thank you so much.
Thank you so much.
Are we through?
As the discussion of late life issues accelerates, a number of initiatives, large and small, are emerging in Minnesota to address these challenges. Here's an example of a program that creatively addresses artistic and social needs of all family members.
Doris has a form of dementia called primary progressive aphasia. The symptoms, instead of being like memory loss, like in what you traditionally think of with dementia, is with her speech. We wasn't sure how it would go at first, but we managed, So some of the songs that we've sung, I'm not sure if she knows them or not. So together we're trying to figure it out. It's kind of a doing it together kind of a thing.
Without her, I'd be gone.
Not true, but we do have a lot of fun.
So when I see Annie and Doris together, and I know that Doris is not talking much at all, and I know that Doris is singing, when I look and see the joy every week,
the tears flow. Because they're singing these words together, they're kind of getting close to each other. They're sharing something that goes beyond a conversation, beyond regular kinds of communication. They're communicating through music.
Many people who are further along than I am start to have more difficulty, and it becomes harder for them to socialize.
The community aspect of the choir has been very, very important, and we planned on that because one of the things that people here have said is that when their loved one has a diagnosis, sometimes people kind of back away. People don't understand this disease.
But when they are in the choir environment, they get tremendous support from the other people, other than caregivers, just other people with Alzheimer's. There's no judgment. Everybody's there and having a good time, and we're all the same, and Alzheimer's is really not in the picture there.
They have said when they come here, they are social people, and they love it because they're socializing with people who understand what's going on in their lives. And isn't that what we all want? We want that kind of freedom to be with people who care about us and who accept us for who we are. The joy that comes from people with dementia and Alzheimer's when they are put in an environment to thrive is infectious.
That's a great story. With us now are 3 people involved in creative initiatives to address late life. Michael Hong is the president and CEO of the Wilder Foundation, a St. Paul-based social service and research organization. Lucinda Jessen is the commissioner of the Minnesota Department of Human Services. Jim Epple is the soon-to-be CEO of UCare. Well, Mike Howe, the Wilder Foundation is known for some pretty creative programs. What's out there that really intrigues you when it comes to the issues of late life and helping people live full lives despite some pretty significant challenges?
So one of our aspirations as an organization is that older adults will have what they need to have a really high quality of life. We decided about 5 years ago that one of the things that was a barrier to actually people achieving a higher quality of life was actually the people who were taking care of them in late life stages and issues. One of the primary barriers to caregiving and supporting people who are actually aging in place or aging in the community or are experiencing memory loss is that they don't identify as caregivers. And so because they don't identify as caregivers, they're stressed out, they're trying to get medications, they're trying to work full time, is that we pulled together a coalition of people to actually build a caregiving initiative so that we could have caregivers help self-identify, have them plan early with their loved ones, identify things and decisions that they want to make, and move forward. There are lots of organizations and nonprofits across the state of Minnesota that are doing great work. We just pulled them together because people often don't know where to go for support, and caregivers are usually the conduit because by the time that they reach out to a nonprofit, say in rural Minnesota or even in St. Paul, they've moved too far along in the process of dealing with chronic illness or memory loss issue.
Boy, I tell you, Commissioner, that seems to be an issue when you hear about coordination of services, not only for caregivers, but those dealing with serious health issues. What's the state doing about that?
Well, we are really fortunate here in Minnesota. I mean, we can all think of some additional things that we would like to do, but we, working with nonprofits, have really, we have a broad array of supports for people in those later years, not just in our healthcare system, but really that enable people to be where they want to be, and that's often at home, so that they can bring the services to them. So whether it's the chore service or the meals or transportation, the medical appointments, some technology, we have options for that in Minnesota, but the hard part is knowing how to get them and how to navigate them. And that's where I think we're really lucky here too. We have what we call the senior linkage line. And anyone can call and get the help they need navigating those services. And it doesn't have to be just the senior. But you know, when my parents were here and needed services, I called it, and I got help navigating the system. And so I think we really have some great opportunities here.
Jim, what do you think?
I agree. I think one of the most exciting things that's happened over recent years relative to this whole topic is going from talking about health as focusing on medical service and the provision of clinical services to broadening the definition to talk about health and probably more importantly, well-being. And it's not just about what medical care we're going to provide to this person. We're going to look at the whole person. We're going to look at their situation. What do they need to be in a state of well-being? So for instance, UCare has a partnership with Lutheran Social Services to provide companionship to seniors who may be isolated, may need basic chores done, may just need companionship. It's a part of well-being. And I think the other thing that's been referenced here is the changing face of healthcare teams. It's not just about doctors and nurses anymore. It's about care coordinators and navigators and guides and social workers and all those people who come together to try and figure out in each instance what's best for that particular person in their particular situation.
Michael, I'm wondering too, when we talk about programs and well-being, how does that translate to other cultural communities in Minnesota when it comes to specifically culturally sensitive programs?
Yeah, so we have some elderly programming at the Wilder Foundation for Southeast Asian seniors, and it looks different and it feels different. And so what I say is understanding and having people who reflect the people that you're serving and identifying with is helpful. Speaking the right language, having the right types of food available at those particular sessions, caregiving and supporting someone that you love, who is going through a difficult transition, and you're going through that transition too, is really challenging. It comes out different for different populations. So, for example, in many Southeast Asian cultures, you internalize a lot more than expressing outwardly what some of those challenges might look like. So, a person may be going to work every day and, oh, I'm doing fine, I'm doing fine. Well, they're really not fine. So having that level of support for the caregivers and the people who are being supported through that process may look different depending on the culture that you're part of.
I think we're really learning that healthcare is not a one-size-fits-all commodity. Cultural competency is a term that you're hearing more and more these days. If you've got a Somali patient at home being supported by the family, and you're going to send somebody in to work with them, they need to understand the customs and norms and traditions of those people. And so I think we've come a long way in terms of recognizing that we need to be patient-centered and individualized in our approach.
Commissioner?
But I think what we're seeing is really a shift in the way we think about those final years and days, which can be challenging. Instead of thinking, okay, that's the healthcare system's problem to take care of, and we think these are people who they should be in the hospital or in a nursing facility, that a lot of those people want and can be at home. And so instead of thinking of sending them to healthcare services, we need to bring services to them. And a lot of it is beyond just healthcare. It's the chore services and it's a help for the caregivers. And I think our state is really starting to make that shift in approach, which is, I think, really good for Minnesotans.
Is the money there, though, for that?
I think we invest more in this than about any other state. But there's money through our public programs for people who qualify, but a lot of these supports are also available on a sliding scale basis for others as well. Obviously, there's not enough money to have paid help for all of this. We still count on families to provide over 90% of the care, and that's why supporting those families is so important.
Are you seeing changes in the workplace, too, when it comes to understanding bosses to let you have time off, perhaps, to help a family member?
Yeah, one of the things that we're working on is trying to get employers to recognize that actually it's their most senior employees in the organization who have a lot of work experience who are ending up caregiving and working at the same time. About 50% of us do, which is a really high number. So there's productivity that's lost at work. Employers are part of that community support system. And there are a lot of policies that employers can actually adopt to make it easier. Teleworking is one of those things. A couple of years ago, we partnered up with a number of nonprofits and enabled employees to actually use sick time, which is already on the books, to provide caregiving activities to people who live with them. That was a major change for the state of Minnesota. Great win, and really affecting the workplace and affecting the types of supports that we can actually make for the people that we are aging in the community.
All right.
Yep.
Wish we had more time. This is such a fascinating topic. Thank you for being here. Appreciate it.
Thank you.
Well, finally tonight, we'd like to ask for your help. All across Minnesota, people and organizations are beginning to do the hard work of addressing issues related to late life. Here's some conversation from a recent public gathering of stakeholders in this debate.
70% of us are going to need some sort of long-term care when we're 65 or over, 70% of us.
As we look back to the last 150 years, it hasn't been that many where aging was considered a medical condition.
We are more than just a body that needs medical care.
Sister and I observed, while looking around, that we are the two examples of the late life table.
We'd like you to join the conversation. If you are aware of grassroots initiatives, big or small, that address late life challenges in inspiring ways, we want to hear from you. Email us at lifecourse@tpt.org, sending us a brief description of the project you wish to highlight. That email address again is lifecourse@tpt.org. Once we've gathered your suggestions, we'll check out these projects, and later this year we'll get together again to see how these efforts are helping Minnesotans rethink the challenges of late life. We hope you'll join us then. We appreciate you watching.
Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose Life Course project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.